Certified Nurse Midwife by Lida, Cako,
and Brittney, Montgomery. In this presentation, we'll introduce the Certified Nurse Midwife, job responsibilities, standards of care, educational requirements and qualifications, and impact of the Certified Nurse Midwife on the nursing profession. One of the most fulfilling and lucrative nursing specialties to consider pursuing is that of a Certified Nurse Midwife. If you're someone with a strong sense of interest in women's gynecological health, prenatal and postnatal care, becoming a certified nurse midwife is a perfect career path. Today, just about 10% of U.S. births are attended by midwives. And according to the American Midwifery Certification Board, as of August 2016, there were 11,475 certified nurse midwives in the United States. However, over the past few years, there's been a growing interest among women to consider having their births led by midwives. According to a report in The Atlantic, midwife-led deliveries are generally lower tech, less invasive, and less inclined toward intervention without a clear medical need. The article cites a 2011 study in the journal Nursing Economics, which also found that when midwives work in collaboration with physicians, the birth is less likely to end in a C-section. That notion could be one of the reasons why the employment of nurse midwives is projected to grow 25% from 2014 to 2024, which is much faster than average for all occupations. Overall, the nursing profession is in a period of high growth, but it is even more true for specialty roles like certified nurse midwives. According to the Bureau of Labor Statistics, the median salary for certified nurse midwives was $99,770 as of May 2016. Because it is an advanced nursing specialty, the earnings are significantly higher than that of a standard RN. It's also worth pointing out that this represents a median salary, meaning that there is the potential to earn even more depending on the geographic location, experience level, and other factors. The growth of midwifery is supported by published research that shows certified nurse midwives provide high-quality care, have comparable or better outcomes than physicians, high levels of patient satisfaction, and decreased healthcare costs due to fewer interventions. Nurse midwives have numerous responsibilities, but generally they are focused on women's health care. Among their common duties include delivering babies, providing prenatal and postpartum care, assisting OBGYNs, and performing routine checkups to pregnant patients. According to midwife.org, 53% of certified nurse midwives identify reproductive care and 33% identify primary care as the main responsibilities of their full-time positions. This includes things like annual exams, writing prescriptions, basic nutrition counseling, patient education, and reproductive health visits. Also worth noting is that as of 2014, almost 95% of births attended by midwives took place in hospitals, with the rest happening in birth centers or homes. Like most healthcare professionals, being a certified nurse midwife means working non-traditional hours and being on call to respond to patients who go into labor. Certified nurse midwives typically work in private practices alongside OBGYNs in hospitals or in birthing centers. The certified nurse midwife standards of practice include managing pregnancies and deliveries, providing postpartum care for mother and baby, providing newborn care for the first 28 days of life, and managing primary care for women throughout the lifespan.
I will discuss now the education and licensing requirements of becoming a certified nurse midwife. Aspiring nurse midwives must fulfill a number of prerequisites prior to practice in most of the regions in medical settings. The first one is to become a registered nurse. by finishing a bachelor's program in nursing. Of course, pass the NCLEX exam and maintain the credentials and gain experience 1 to 2 years, preferably in a OBGYN field. After that, the person needs to enroll into an accreditation commission for midwifery education approved graduate program. They can be 2 years if it's a master and 4 years if it's a doctorate program. Currently in the United States there are 39 accredited programs to become a midwife. And the final step of becoming a certified nurse midwife is the certification by American Midwifery Certification Board. You have to sit for the exam within 24 months of finishing the graduate school. You need, of course, to pay the fee and have a letter of recommendation from the head board of your school. The credentials are good for 5 years, and then they can be renewed by either completing the approved maintenance modules or by retaking the exam. Now I will discuss the impact of this profession, the certified nurse midwives, into the general nursing profession or nursing field. The first one being a nursing shortage. This is a dual issue. In one way, when nurse midwives go through the graduate school and get certified, they create a shortage into the RN field. And then on the other hand, there are several studies that project a shortage into the midwife profession. Currently, 56% of the U.S. counties don't have a nurse midwife. There are several reasons that will factor this shortage. For example, the female population is projected to increase by 18%, and the number of births is going to be up to 4.2 million by the year per year by 2030. So this will impact the shortage into the nursing midwife profession. When it concerns nursing care outcomes, several studies have shown that midwifery profession has better nursing care outcomes, such as fewer cesarean section, fewer low birth babies or premature, and significantly increased breastfeeding rates. Like many other professions, the healthcare reform also affected the midwifery profession. Now the Medicare payment for certified nurse midwife services is increased to 100% as compared to 65% that was before the change of the reform. And then midwives can initiate a well woman or an annual exam, which increases access to care for low-income population. Certified nurse midwife also create healthcare economics benefits, such as reduced use of selected labor and birth interventions, reduced maternal duration of stay, and reduced overall cost of care relative to the OBGYN. The scope of practice of certified nurse midwife is evidence-based, and it integrates the best available evidence generated by research, clinical evidence and expertise, and it's based on relevant contextual knowledge. Certified nurse midwives should be aware of the changes in law that affect the profession to decrease the legal issues that impact this role. They should be aware of the pregnant patient Bill of Rights, like the right to know any hazard or risk for herself or the unborn baby by administering any drugs or procedures. Some of the potential problems in the field is failure to recognize complication, failure to get consent, and in general they should be aware of the medical legal problems that involve the scope of practice of a nurse practitioner midwife. The profession of certified nurse midwife has increased the quality of care for pregnant patients. because a certified nurse midwife is highly educated in nursing and midwifery. The profession makes efficient use of the resources, and several studies show that it reduced maternal and neonatal mortality.
Embarking on a certified nurse midwife career is exciting but challenging. To learn more about the profession, it's a great idea to explore the career resources and information that professional organizations have to offer. The American College of Nurse Midwives is the professional association that represents certified nurse midwives. The American Midwifery Certification Board is the official board for certification. The Accreditation Commission for Midwifery Education accredits midwifery education programs. Thank you for your time. Below you can find our references. Thank you for your time.
Thank you for your time.